Good afternoon. Thank you for joining us today. This is the Choices Community of Practice September Coffee Chat. I hope that you're all doing well and enjoying the start of the fall season. The topic for today's coffee chat is cost-effective communication resources to engage your community. My name is Molly Garrone. I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health. As always, I am happy to be facilitating this coffee chat. As always, I want to acknowledge our funders who make this work possible and share that our Choices work and events are only for research and educational purposes. So the intention of today's coffee chat is to provide information, tools, and resources to inform and educate, and we're not looking to influence any specific legislation. If you are unfamiliar with the Choices Community of Practice, it's a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. It's our goal to support these efforts by providing tools, resources, and training opportunities. And our coffee chats are unique, informal opportunities to gather ideas, innovate together, and get to know each other better. So for today's event, we will listen to a short presentation from our guest speakers, and then we'll have some time for a full group discussion. We encourage all of you to share questions or comments in the chat throughout the event today. For today's coffee chat, we are excited to be joined by partners from the State and Community Health Media Center at the Centers for Disease Control and Prevention, who will highlight examples of free and low-cost resources and share several best practices to support public health professionals in effectively communicating about their work to their communities. So our goal for today is to share about those resources and best practices that can help you engage your community in your prevention work. So we're excited to be joined by Suzanne Gates and Jana Scoville. Susie Gates has worked in public health at the local, state, national, and international levels for more than 25 years, ranging from marketing, audience research, and campaign implementation to consumer health informatics, personal health records, and CDC info contact center management. She is the communication team lead in CDC's Division of Nutrition, Physical Activity, and Obesity in CDC's National Center for Chronic Disease Prevention and Health Promotion. Jana Scoville is a project lead and communications practitioner with more than 20 years of experience in the agency, government, and nonprofit sectors. She currently leads the web-based communication support team for CDC's State and Community Health Media Center. For more than 12 years, she has worked with CDC's grantees and partners to support strategic communication planning efforts. So welcome, Susie and Jana. We're so pleased to have you here with us today. So at this time, I'd like to turn it over to you both to begin your presentation.
So fantastic. Thank you. Welcome again. I want to thank Jenny and Molly and Angie for inviting us today. Jana Scoville will join me. She heads up the SCHMC, the State and Community Health Media Center. We will also call it the Media Center for short. So my intent today is to cram about 3 hours of training into about 20 minutes. So just buckle up, we're going to get going. So truthfully and seriously, we're going to, go over the surface of a lot of things. There's a lot of depth in here that we're just kind of talking about. And so these are trainings unto themselves. And we'll give you an opportunity to join up for communication specific trainings going to the future, or if you have staff who want to join those, you are welcome to join. So with that, let's get started. So let me just highlight what we're going to cover. We're going to cover the state and community. We're going to cover communication and strategic communication and what that means. And then we're going to talk a little bit about the State and Community Health Media Center itself and some of the resources that are in it. And sprinkled throughout, you're going to get some best practices, lessons learned, and then a bunch of resources at the end on physical activity, on nutrition, on features that you might be able to repurpose. So we have a lot of those types of resources that will be in the chat, and you'll have those links. Okay, doke. And get going. Next slide, please. So what is communication? We call it strategic communication. It is interchangeable. People will talk about media. People will talk about marketing. Some people talk about public education. Oftentimes it's used interchangeably. What it means is using a mass channel to reach a specific audience. It is more than public service announcements and brochures and presentations. It's really intended to engage, inform, and educate individuals and groups, communities. It's intended to help you increase knowledge, affect attitudes, encourage new perspectives and approaches to make healthy living easier. So some of you have probably seen this pyramid. We wanted to put a big circle on where communication is with changing the context. So it is not up there at the tippy top with, education and clinical intervention and one-on-one. It's down and it's more foundational. So this is intended to surround sound, right? It's to make healthy living easier. And communications task within public health programs is to reach wider audiences and create a climate that encourages healthy living and builds support for and facilitates program changes. Sometimes we call that ground softening. It's increasing awareness and support. So in this community change context, what can communication do that was reflected in the health impact pyramid? So we are looking at ways to improve choices where we live, where we work, where we learn, where we play. And so it can inspire conversation. It could draw awareness to your issues, right? It softens the ground for those conversations. It also helps advance your program work because it creates a dialogue at the top in addition to softening the ground on the bottom to generate receptivity. So when you start sharing your successes, that actually helps support this change because people want to be part of a success. And communicating your wins early helps generate support in the long haul. So a continuous conversation, continuously talking about your successes. And then when audiences large and small, they see those results, there can be a true increase for demand, right? You've normalized the efforts, you've advanced the program, you've increasing the demand. It's not one of those build it and they will come. They have to know about it, right? And they have to desire it, and it has to fit a need or a value in their life. And that is all generated through audience research, which we're going to talk about. So I am going to turn it over to Jana to talk about the Media Center.
Thank you, Susie. And hi, everyone. So happy to be with you today. So the State and Community Health Media Center, again, Susie mentioned, it's also known as the Media Center or SCHMC. It's an online repository of ads and other materials, including photos, that support obesity prevention and other chronic disease prevention topic areas. Some of the topic areas include some that you see here on the screen, and there are many others, but a few are nutrition, physical activity, breastfeeding, diabetes, heart disease, flu, immunization, reducing sodium, sugar and sugary drinks, and social and emotional well-being, and more. The materials come into the Media Center from public health agencies, such as state and local and tribal organizations. Most of the ads within the Media Center have been audience tested, and through this, users can see how the ad or the material performed with an audience. So this is, of course, a great help to users when selecting ads and materials to use in their communities and testing before use. The Media Center within the Division of Nutrition, Physical Activity, and Obesity with CDC is the sister site to the tobacco site called the Media Campaign Resource Center, where you can find smoking prevention related ads and materials. So we wanted to make that note as well. So next, we want to share an example of how audience research informs a campaign from the state of Alaska Department of Health and Social Services. Alaska has a Play Every Day campaign, and we want to share a little bit about that. Before we get into this example, I do want to say that I do not represent Alaska in any way, but just do want to make a few key points based on materials that they've placed within the Media Center and publications that they've produced. So the Media Center houses many of the Alaska Department of Health and Social Services Play Every Day campaign materials. The problem that Alaska was facing back in 2012, they were dealing with high rates of obesity, and they started a campaign designed to help Alaska children ages 5 to 12 grow up at a healthy weight and encourage families to be physically active and choose healthy drinks. From the beginning of the campaign, they used audience research to inform the communication materials, and also used a survey research to evaluate the campaign. Each year, the Play Every Day campaign has used a mix of strategies to reach Alaska parents living in communities across the state, many of which face challenging differences in how they access media. The campaign used focus group discussions and key informant interviews to inform message development, as well as regular telephone surveys of Alaska parents. And the campaign placement included public service announcements on broadcast, cable, TV, as well as online and social media and print materials as well. So in 2018 and 2019, additional focus groups were conducted with parents of school-aged children. They tested multiple storyboards that featured 2 public service announcements, including the donuts PSA that you see here, which used a sugary treat to illustrate how much sugar is hiding in a small fruit drink. Participants said the messages were meaningful, memorable, and motivational. And after the sugary drink PSA aired, the Play Every Day campaign conducted a survey to measure changes in knowledge, intentions, and behaviors related to drinking water and low-fat milk instead of sugary drinks. The survey results showed a small but statistically significant increase in the percentage of urban Alaskan parents who knew the amount of sugar hidden in soda. So they did view that as a positive. And this is just an example of an earned media article followed by a publication about Play Every Day's evaluation. This was published in the peer-reviewed Health Promotion Practice Journal. So just wanted to provide you with this in case you want to view more information about the campaign. Now I'll turn it back to Susie, who will talk about the lessons learned and best practices for social media and social math.
Alrighty, let's get started with some lessons learned. But before we do that, I put in the chat, if you would let us know what kind of resources you're looking for or you think you'll be looking for, and just put that in the chat, then we can take a look at that as we go. That's always informative to us for what resources to keep an eye out for the Media Center going forward. Also, if you have resources you would like us to consider for the Media Center, or you have seen resources that you think we should know about, please put that down too, and indicate that that's what you're doing, so that that's a treasure trove for us. You all have your eyes, you know, you're out on the ground and you're seeing things and things that you like, and it's always good for us to know that, because we don't hear about everything, and it would be very helpful. So I am going to switch gears. Jana talked a little bit about the Media Center, a little about Alaska. Now we're going to talk a little bit about social media and social math, again, at a very high level, 2 things that we've spent hour-long webinars on, but giving you some kind of key pointers about them, and also showing in the examples some of the resources that are actually in the Media Center, so that we keep that awareness going. Okay, so the paid media landscape. is an ever-changing landscape, especially in the digital and social media and online arena. It's constantly evolving. So here are some of the current trends. I'll just touch on some of these. First, there have been changes in social media, particularly Facebook and Instagram, but across the board. You used to be able to actually really hone in on the audience that you're trying to reach. You can still do that, particularly if you're using like area codes, zip codes, and kind of honing in that way because you know which areas you're trying to reach. But it used to be you could say, I would like to reach, a certain ethnic group of mothers with children of a certain age, and you could really kind of narrow it down. But the ethnicity piece, the racial and ethnicity piece, has really been scaled back. So you have to work arounds, particularly if you have, any kind of geographic information that can be helpful. You all know this. We all have our phones, right? So mobile first strategy for everything. If you do a website and it's intended for consumers, that page needs to look good on a phone and probably primarily look good on a phone. At CDC, with our own website, we split because we have a lot of professional, public health people coming to our page, but we also have consumers. So we have to make sure that our pages look good on various platforms. So, and video is, it's here. 15 seconds or less. If you can turn something into a video or an animated or moving image of some sort, that is best. And then also this omni-channel, right? So this is going across multiple channels and being strategic about that. So, all right, we've got our website we're trying to drive people to, but we're also going to put something paid on Instagram and on Facebook. But we're also going to put something over in the digital area. Maybe we're going to put ads on certain pages that people are looking at. And then everything is kind of driving to that website or driving to the action that you're needing or signing up for something. So multiple exposures is ideal. And Roku, we just did a campaign on Roku. If you all have access to Roku, some of this more sophisticated advertising may need a contractor who can kind of do that interface for you, but there are things that you can do yourself. Here are some of the things that you can do. And I'm not going to read all of these, but placing ads on social media platforms, you can do that. You're trying to reach a certain group, you pick that group and it goes out. You can boost ads. If you have a post, if you have a post that's doing pretty well, or you are really trying to reach a certain audience, you could take a post and you can put $15 behind it, $25 behind it, and see how it does, and then pick your audience and do these like little pilots. What's working, what's not working, is if the action is reach, or if you're trying to reach people, that's one metric. If you're trying to get them to click, that's another metric. And then there is this paid search options, keywords. You can do that through Google or Bing and other search engines. So you've got keywords, you're trying to, somebody is searching on X, Y, and Z, and then up comes your ad, right? So you give them the keywords and then the ad to deliver. Those are some kind of lower intensity things that you can do to get started. So this is just a few things to keep in mind. These were pulled from a blog on social media strategies. So you have to kind of pick the right time to launch your campaign. Monday through Thursday is good. They're prime days to launch and to drive engagement. If you're going on, a Sunday or a Friday, Saturday, you need to have a very good reason that your people are there. But yeah, Monday through Thursday is the day, are the days to look at. Look around what's going on. How can you make your campaign relevant and timely. Staying flexible, that those kind of two things go together. Having the resources, that's one of the nice things about the Media Center, is you've got some resources and then you've got an opportunity that comes up. And so you just plug it in, right? So it's a little bit of flexibility. You can move pretty fast, but you just have to have, be ready, right? So you have some resources and you're ready to go when the opportunities arise. And you can leverage observances and those kinds of things, when that is happening, so you can plan for it. You can also share these materials with your partners. And if there's a social influencer, I'll caveat the social influencer with a little bit, but you can share this or have your partners engage with your social media, but you also can give them social media resources to also be driving to the same place that you are. My caveat for social media influencers is obviously you have to vet them and you never know what they might do tomorrow. So, be careful. We all have seen the news headlines, right? And then you can use previous campaigns that others might have used, as long as you test it, make sure it works in your environment and with your audiences that you're trying to reach. And that's one of the reasons that the media campaign is, the Media Center is so great. And Jana mentioned this, audience testing, you're going to hear us say that, audience testing. But you can keep testing short and finite. You can do A/B testing online too. You can put up two things and see which one is doing better, but it's also good to actually get ads in front of people and get their reactions and hear what they say, so that you are hearing, is it having the intended effect? It's meeting what we know are motivators for people. So you can use your qualitative and quantitative research to inform, to inform your messaging, and then, use those same kinds of techniques to see if the message is resonating and be ready to modify it if it's not. Okay, so we're going to switch gears. We're going to talk about social math for a bit. Y'all may or may not have seen this one. This is one that we did in our office for physical activity and building a strong, healthy America. So the intent of this is to take of social math is to kind of streamline our stories and connect them to the data. It creates a relationship with the numbers and people and places and things that our audiences may already be familiar with, right? So it tries to make numbers more familiar and relatable. So I would say that it's part of a larger approach, and you all probably know and have used data visualization. So social math is just a piece of data visualization where you're presenting really complex ideas and places in a graphical form, so it's easier to understand. So this is also really good information to share with partners, and then they can share it around with you. So Jana actually we put the link on this page if you want this, if you want to see this example when the slides get posted. All right, so these are some other examples of how data has been brought down to make it more visual. This one on the left is a very old one, but we thought it might be informative because, even though it's old, it might still be good to test. It might still be good to, you'd have to update it, but we thought, oh, this is a good example. The one next to it is teaspoons. Right now, as we speak, we are in the field testing another version of this that is like the one to the right of it with packets. And we are testing it with a group of young adults, Hispanic young adults in Nevada, and with West Virginia young adults, and they're mostly rural. So we're actually seeing, and we put up multiple ads of different kinds. And now we're seeing which ones are, it's an experiment, but we're letting, instead of putting equal amounts of money on each one of the ads, we have 4, we're letting the algorithm based on clicks decide which ads to put forward first. So we don't have the results, but that is how we're doing it. The next one is this sodium, and we thought, again, another old one that we thought was a goodie for you to see, how do you take sodium data and make it visual? Okie doke. That's it for me, and I'm going to turn it over to Jana. Yeah, there we go. Thank you.
Okay, great. So now we want to talk about who can use the Media Center. So now that you've reviewed some examples, we want to share some information about how you can actually get into the Media Center and use it and share more information about it. So who can use the Media Center? So want to just let you know that anyone can search for ads or materials or photos. However, you must have a user account to view television spots, watch television spots, listen to radio spots, and also access the audience testing information that is available within the site and attached to most ads within the Media Center. We'll share with you in an upcoming slide how you can create a login. So Media Center accounts are limited to government agencies, and that's state and local health departments and nonprofit organizations who are working on health-related campaigns and work. Users can get an account by providing their name and email address and organization name and their reason for requesting access. And users should only use ads and materials and photos that support chronic disease prevention program efforts. And we will talk about why use the Media Center. So the Media Center provides a one-stop shop for organizations searching for audience-tested materials. It was established in 2012, and it has made finding, reviewing, and choosing and placing advertisements in a wide variety of media markets both easy and cost-effective for many organizations. If your program wants to produce its own ads and materials, the Media Center also can provide inspiration for ads and materials and messages for you. When you use an ad from the Media Center, you can add your logo or website to the ad or material for a small fee, which covers the cost of the work. The small fee is typically between $100 to $1,000, depending on the type of material. Of course, print ads are more expensive, less expensive to edit than video, for example. And the next slide, I'll share an example to give you more information. So here's an example of how the Media Center helped one local health department save time and money. On the left, you see that a new TV spot on a healthy food and drink topic took about $45,000 in 4 months to create. And then the next year, the same local health department chose to continue their efforts using the Media Center. They found an English TV ad and asked to have it translated into Spanish. So the right side shows the 2 ads cost under $1,000, and that included the Spanish translation and tagging cost as well. And that all took about 10 business days to produce. So by using the Media Center there at the bottom, you'll see that the local health department saved an estimated $43,000 in 3.5 months in production time. And so obviously a big savings there. So this slide shows some of the print ads that are available in many different languages. So the Media Center includes ads in many, many different languages, including English, Spanish, Vietnamese, Haitian Creole, Portuguese, Hmong, Nepali, and many others. So we do encourage you to go out and look at the Media Center ads that are available. And this slide includes some of our newest ads focusing on flu and maternal health and breastfeeding, also nutrition and physical activity topics. And again, you'll see that some of these are also in different languages. And one of the biggest benefits of the Media Center is that it does offer free photos with your account. So once you create an account, you can come on and browse the more than 300 photos available in the Media Center. And the photos represent different ethnicities and are available for automatic download after placing an order, so a brief order form that you complete to use that photo. Again, though, you must have login and access to the Media Center before you can download those photos. So here we wanted to just share just a few key steps for using the Media Center. So the very first thing is we encourage you to visit the Media Center and register for an account. On the right of the screen, you'll see the login and registration buttons where you will go to create that login. Once you're logged in, you can access the full capabilities of the site and come on to the search page where you're able to search many search filters to find the ads and materials that support your program and communication objectives. We want to let you know that once you're in there, feel free to request a free consultation. So we provide free technical assistance, and you can do that by emailing us at the email address you see there on the screen. It's schmc@cdc.gov. And we're more than happy to share with you any information that we have about an ad or material that you may be interested in ordering. There is a brief order form and process for ordering the ads, and as we mentioned, a small fee for having your logo placed on the materials. Once you place the order, you will receive an estimate and an ad use agreement for your organization's signature, and you will then very quickly receive the ads in about 10 business days once the order is placed. So it is a pretty quick process. So here we want to just again reiterate and share that that we are always looking for new materials. So if you have a campaign and you are interested in submitting it to the Media Center, we would love to see that. So please do let us know if you have any ads, materials, or photos that are audience tested and can be used by a third party or other organization. And again, to do that, just email us and we will be happy to work with you to bring those, to consider bringing those into the Media Center. And we want to leave you today with just this list for producing new content. So if you are working to produce new content, this is a great checklist for you to take and for considerations, especially as you're working with an advertising agency, to ensure materials have a long shelf life and can be used by others. So encourage you to look at this list. And then also just want to mention that as Susie mentioned several times, the local audience testing is just so critically important. And we do offer low resolution copies of any of our advertisements in the Media Center. So if you would like a low resolution copy, we can share that with you and send that to you upon request. So please just email us at the schmc@cdc.gov email address, and we're more than happy to do that. Thank you. Thank you all so much. And I think now we'll open it up for questions.
Yeah. And Jana, before we start taking questions, and we have a few in the chat too, I do want to just reiterate, can we go back to that slide that we just had? Y'all, we're going to give you these slides and you need to take this slide and just use it. Every time you're producing something, think about, am I going to want to use this again in the future? Do I want somebody else to be able to use my stuff? And if that's the case, then follow this list, because there are talent restrictions if you don't buy it out front, if you don't have it up, a release up front. You can't find those people, or maybe they've, gone on to become Brad Pitt or something. So you really, this is very important. If you want to be able to use your stuff in a year or 2 years yourself, you want your partners to be able to use it, you want to put it in the SCHMC, this is your kind of checklist of what you need to consider. Okay, I'm off my soapbox, but so many times people get down the road and then they don't have this stuff and then they can't use it, right? And so it's not a good investment for the long term. Okay, so we had a few questions. Cassie, we do have photos. You're good on that? You good on that? You can come off mute. If so, or you can just type in. I think you saw the photos. You do need a login. You can download them directly. Gail, the Media Center materials are not for everyone. You do need to be a nonprofit. You do need to be health department, NGO. You need to be a nonprofit. Some of you, if you have contracts, if your contractor needs to order something, then they need to tell us that they have that they're working for you, and then they will get access for a limited time. They won't have continuous access because they're getting that access for you. We would love for you to use the materials in the Media Center. So Jana will, if it's not already in there, we'll give you the email address and the URL, and there is help. And so always, never ever suffer in silence. The Media Center staff are there to help you. And Clint, I would love to learn more about story maps too. We might be able to line that up in one of our communication trainings that we do every other month. We have seen places, we have seen like different communities using, and different states using the maps and connecting their stories to it. So I would love to learn more about it too, and how others are using it. All right. Do we have any other questions?
I think I'm going to jump in with a question I have for you both. First of all, thank you, Susie and Jana. That was a wonderful presentation. Our choices work is kind of focused on identifying effective strategies to promote nutrition and physical activity, which we sort of base on a specific set of criteria. And I'm just wondering what sort of criteria are required for ads to make their way into the state and community health media center, if you can share a little bit about that.
Jana, you got that one?
Sure. So first and foremost, we do require that materials are audience tested, that they are free of any talent and usage rights that would restrict them from being able to be used by others. And then a couple of other things is we do look at if the ad has any geographically limiting elements, for example. So for example, if the ad has palm trees, and we know that the larger audience in the media center may not be able to use that, it may not be as much of interest to come in. So just geographically limiting elements, as well as making sure that the ad is evergreen. So making sure that it's not tied to any one day of the year or any one time frame, so that it can be used over a period of a couple of years and not any one time frame. So those are just a couple of things that are a few things that we look at.
And Jana, we have in the past, if there were palm trees, we've asked the originators, can we change those to oak trees? So we have done that in order to be able to capture the rest of the, other parts of the country.
That's great. Thanks for that. Looks like another question in the chat. What advice and suggestions do you have for creating a paid advertising campaign, both for social media and other digital or paid search advertising?
So my two mantras and can become your mantra: who's your audience and what's your objective? You have to know that, because people get distracted by the bells and whistles and fun stuff that communication can do. Oh, we could do that. Oh, let's do that. But then, is it strategic? Is it reaching your audience? Does it have an effect with your audience? So I would say, some of on that list, try to do multi-channel, but know that audience, have done your audience research, know what motivates them, know what their pain points are, know what is of a value to them. And then you can dive in and I would use not just qualitative, but use quantitative data. If you guys are putting out a survey, put some communication related awareness, knowledge, motivation, value type questions, and we have those and can share those with you into your quantitative so that you can cross tab it, right? You can look at it and you could say, okay, this is my audience and this is, I'm trying to reach. And then you can say, oh, well, this is of what's value to them, right? And so that's where we should hit on our messaging. So it needs to be data driven and audience informed. So I know that didn't really answer the question, but that's how you can approach it.
Great. I think another question that I have here, what are some alternatives to social media that work well for community outreach? I think maybe some thoughts for other channels or, ways to kind of reach the community that go beyond just using social media. So any examples of other channels or mediums that you can think of?
Sure. So multi-channel, right? So Jana showed you Alaska, when they did their campaign, they didn't just do paid advertising. They did the surround sound, right? So they had news articles, they had newsletter articles, they had billboards, they had radio shows, so a campaign, and your audience, your community. Where are their ears and their eyeballs? What are they reading? What are they listening to? And so, yeah, it's not all social media, but there may be, in some instances, maybe you want to go with buses. Maybe your population is on the bus, or maybe some like kind of in-town advertising. I mean, some people paint the side of a building. So it really depends on where your audience is and where they will be receptive to your message. We have a lot of channels at our disposal. So again, it comes down to who's your audience, what's your objective, and how do you make that objective meaningful to your audience?
Great. Yeah, thanks, Susie. Thanks for highlighting those. And I think it looks like Allison in the chat also shared they host listening sessions, walk with a doc at their federally qualified health center to go along with their media campaigns. So those are really great suggestions as well. So folks, we have a few more minutes if there are other questions. So maybe before I take our last questions, I also want to invite everyone to just think about something you learned. Certainly Susie and Jana have shared so many great tips and tricks today. So something you learned or something you might take away from today's coffee chat, please share that in the chat. We'd really love to see that. I also want to lift something up that you said in the very beginning of the presentation, Susie, that I really loved, and that was to communicate your wins early and continuously share your successes. So I want to reiterate that to this group. I think that's a really nice broad tip to keep in mind for this kind of work that can be impactful for folks. So thank you for that. So any final questions or thoughts from folks, or anything from you, Susie or Jana?
So I want to go back to Jesse's comment in the chat here. Do you accept resources from other funding sources? So yes, with a caveat. There have been some materials that have been developed by some organizations, like I think WIC might be one of them. And Jana, you can weigh in on here. There are some where they have their own resource center. And so we can refer people to them, but we don't necessarily, and we talk with the agency, the federal agency on the higher level. So we have talked with other health and human services agencies to bring in ads. We have brought in Move Your Way and a number of ads from other federal agencies. So it kind of depends. I mean, if you produced it even though it was funding stream, USDA, it shouldn't be an issue. But if they produced it, we should talk to them directly. And Lauren, Roku and Simplify. So we just did a campaign using Roku and Simplify. For what we were trying to do, Roku actually delivered better. I mean, you guys know, well, you may or may not know, Roku does geofencing, right? So we were able to pinpoint households by zip code, area code, really hone in geographically so that we could reach them. And then they did this multi-channel advertising through Roku, and it was very effective, very effective. Oh, that's it. That's it, Jesse. It's SnapEd. It wasn't just WIC. Yeah, mostly funded by SnapEd, produced by the county. Okay. I mean, if they own the rights and they did the production, it probably is fine, and we don't need to talk to SnapEd directly. But it may require us to have a conversation with SnapEd. Oh, you know what? So Lauren, yes, we were working with NACDD in the spine states. Yes. Fantastic. I'm so glad that it went well for you. I just presented on it on Tuesday.
We absolutely loved getting to participate in that ad campaign. It was so hands-off for us, and it reached the exact population we needed it to reach. I think we got like 16,000 clicks on our website with some of those ads that I saw previously in this presentation. And there's another round of it for us spine states. And so we are going to be applying again.
Oh, fantastic. Fantastic. Yeah. I didn't know if they told you already, but yeah, there's another round, like to see what works and what's, is it better to be central? Is it better to be dispersed? And we really like this model. Oh, how do you get an ad campaign with Roku or Simplify? I tell you, the easiest thing is if you have a contractor. I don't know, Lauren, what you would say based on your experience. Do you think you could tackle the Roku thing?
There is
directly?
absolutely no way we could have done what that contractor did. I think it was Rocket Cam for Propellant Media.
Yeah.
And they took care of all of that side of things. They had these really fancy dashboards showing the different click-through rate and the different types of ads they use. They found that there was a difference in the click-through rate if it was an actual photograph of a toddler versus like a drawing of a toddler. I think the drawing was more popular than the photograph. And so we were able to see how everything performed. They literally did all that work for us, and it was incredible.
Yeah, I think you could start small with Roku, but if you want to do an optimized campaign, I think a contractor would help. Okay, and I think we have some resources to put in the chat, right, at the end here for folks.
We
There's
do.
a whole bunch of them.
Yeah, thanks, Susie. I think with that, I'll maybe move us along a little bit to our final notes here for today. But thank you both for your presentation and answering these questions. And thanks, folks. Thanks, Lauren and Leah and Jesse, everything that folks have been sharing in the chat and off mute. Appreciate all the great discussion. So we always like to invite folks to share any suggestions that you have for topics for future coffee chats. So really encourage folks to do that. As always, we like to remind you there are additional resources from us at Choices that are available in our Community of Practice portal. Please take a moment to register as a member if you haven't already done so. We'll pop a link to that in the chat. I'd also like to mention we have a little post-event survey that should pop up on your screen when this event today ends. So we really welcome feedback. And a reminder, we will be sharing the recording from today's session, the slides, and then also a resource roundup document that will include all of the links to resources that were shared today. So yes, as Susie said, there's lots of resources. We'll pop them in the chat, but we will also be sharing those out after the event. So I just want to highlight our next coffee chat is scheduled for Tuesday, October 24th at 1 p.m. Eastern. Note that we usually hold our coffee chats on Thursdays, so this one will be happening on a Tuesday. So just wanted to flag that. And I, again, want to really thank our guest speakers, Jana and Susie. We really enjoyed having you with us today and really appreciate all the great resources and opportunities that you shared about and lifted up. So thank you so much for that.
Yeah, thank you. It was a pleasure.